according to the American Cancer Society, colon cancer, the third most common cancer among men and women in this country. And in honor of Colon Cancer Awareness Month, Dr. Brent Wallis from People's Health joins us to explain how you can prevent it. Good morning, Doc. How are you?
Hey, Tommy. Good morning. I'm doing good. How about you?
I'm good. I hope you get out and do some gardening. You're a gardener, aren't you?
I try. I'm not very good, but I'll be out there this weekend.
I'm thinking about starting again because I'm again like you. I'm not very successful, but they tell me there are apps now that'll keep you from killing plants. So maybe I give it a shot. I understand colon cancer is common, but is it true that it's also easy to detect?
Yeah, Tommy, it's very easy to detect. It's probably, one of the most highly detectable cancers, and finding it is really the key to preventing any of the major complications from it, and really preventing the cancer in a lot of cases. If you can catch it early, the survival rate is north of 90%. But unfortunately, here in Louisiana, we unfortunately have one of the highest death rates in the country from colon cancer. In fact, we're number 4 in the country, about 20% higher than the U.S. average, unfortunately.
So I guess that means maybe we're not catching it early, and is it preventable?
Yeah, I mean, that is one of the problems. If you don't catch it early, then it's difficult to treat and to actually cure it. But if you do catch it early, or even some of the early signs of something that could progress to colon cancer, it is completely preventable and definitely treatable and even curable. You do have to catch it early, though, and people wait too late to get checked in general. Screening rates are pretty low across the country. Less than 40% of colon cancers are actually found early, and the later you find them, the more difficult they are to treat. Here in Louisiana, if you just look at our Medicaid population, about 37% of people that should be screened are actually screened. The pandemic really caused a lot of problems as well, because a lot of people didn't want to go in to get screening, or obviously weren't thinking about their health for quite a long period of time. So we're really seeing a huge decline in those screening rates, and we're trying to make up for what we missed out on over the last 2 years so that we can find those cancers and eliminate them.
I guess, unfortunately, people may look for a reason not to be screened, and it's a shame that they don't, because if you catch it early, a 90% survival rate. And I guess the next question is, how often should you be screened?
Well, everybody should know, there was a pretty significant change to the screening recommendations in the past year. So the age was moved from 50 down to 45. And the reason for that is because we started seeing cancers occurring earlier and actually being more severe in that 45 to 50 age group. So now the recommendation is for everyone to be screened as soon after you turn 45 as possible. And then, the frequency of screening is going to vary depending on what they find on your screen and a lot of other risk factors that you may have. What a lot of people don't realize is there's a lot of different ways to be screened, too. Everybody thinks about colonoscopy, and people are scared of colonoscopy, and so sometimes that's why they don't get screened. But there are other tests you can do. In particular, there's something called a fecal occult blood test that can actually be performed at home. There may even be mobile options for screening. LDH, the Louisiana Department of Health, has partnered with local health systems, to provide mobile units in various parts of the state where you can actually pop in and get screened for colon cancer and other types of cancer as well. So you should definitely talk with your doctor about what your risks are and what your needs are.
And when you're diagnosed, I guess the doctor talks to you about what the options are?
Yeah. So if you are diagnosed with colon cancer, we have a ton of treatments, really innovative treatments that have come out in the last 5 to 10 years. Sometimes it may include surgery or even radiation. Certainly it's going to include chemotherapy. But if you are diagnosed, like I said, if you're diagnosed early, 90% of people do completely fine. So talk with your doctor about what those options are.
All right, let's take a quick break. When we come back, we'll talk about who is at risk for colon cancer. It's Colon Cancer Awareness Month, and Dr. Brent Wallis, Dr. B from People's Health, is here to talk about it. It's the third most common cancer among men and women in the United States, and it has a 90% survival rate if caught early. So we'll talk about prevention, who's at risk, etc. When we come back, 8:20, time for traffic now on WWL. And a half, Tommy Tucker, WWL, talking to Dr. B, our friend from the 5-star rated People's Health Network, about colon cancer, because it is Colon Cancer Awareness Month. Doc, who is at risk for colon cancer? Is there a segment that's more at risk than others?
Yeah, I mean, definitely age, like we've said, plays into it. We see the majority of colon cancer after the age of 45, which is why those screening levels are set there. But in particular, African Americans have a much higher risk, as do Eastern Europeans. And keep in mind, a lot of Cajuns were descended from Eastern Europeans. So that's why there's a lot more risk in Louisiana than in some other parts of the country. But you have to also keep in mind if you have some other types of diseases. So inflammatory bowel diseases like Crohn's disease or ulcerative colitis, those have an increased risk of cancer. And if you've had a different type of cancer like breast or ovarian or even uterine cancer, that actually confers an increased risk as well. And then family history always plays into this. So if a relative has had colon cancer, you definitely need to make sure you're getting screened.
People tend to think of smoking as only something that affects the lungs and heart, and that's not the case, right?
No, not at all. I mean, smoking definitely contributes to colon cancer and a lot of other types of cancers, and it's very controllable. You can quit. A couple of other things to keep in mind. Large amounts of alcohol can increase your risk for colon cancer. Most people know red meats or processed meats can increase your risk. But also just living a sedentary lifestyle or being obese or having diabetes confers an increased risk as well.
Any symptoms involved or associated with colon cancer that we could look for?
Yeah, I mean, that's the problem is most often there are no symptoms at all in the early stages of colon cancer, which is why we have these screening programs. The sometimes later in disease, you may see some change in your bowel habits, possibly some blood in the stool. What I tell people is, if you're having unexplained weight loss, nausea, vomiting, or really a change in your bowel habits, you got to talk to your doctor about it right away.
In addition to getting screened, some other things people can do for prevention?
Yeah, I mean, to prevent colon and all types of cancers, I say it all the time, you have to try to live a healthy lifestyle. Fruits and vegetables are good for absolutely everything, and staying active and maintaining a healthy weight is really going to lower your risk as well. And meanwhile, that's going to help your cholesterol and your blood pressure. And by all means, if you are smoking, please quit smoking. It's going to lower your risk for this and a whole slew of other chronic diseases.
Always comes down to the same things, huh, Doc? It seems like
yeah.
it. How can people find out more about People's Health?
You can go to our website at peopleshealth.com, or as I've said before, come and visit us at our Medicare Center, which is on Veterans Boulevard right at Causeway. We'd love to see you in there.
At 3017 VETS, you can call 1-800-978-9765. And don't put it off. Get screened. Right, Doc? If you're over 45, that's the message?
Definitely. Make a call today.
Thank you, sir. Enjoy your gardening.
All right. Thanks, Tommy. Have a great weekend.
All right. Dr. B from Dr. Brent Wallis from 5-Star People's Health. You can call 1-800-978-9765, or you can follow People's Health on Facebook, Twitter, and Instagram. 9:30, time for WWL First News. For that, we go to Dave Cohen.